Welcome everyone to this webinar on ClearTriage and the free COVID-19 version of ClearTriage with the Schmitt-Thompson COVID-19 protocols. My name is Dave Schmidt. I'm president and co-founder of ClearTriage. I have a few slides to talk to today around what the Schmitt-Thompson protocols are, the COVID-19 protocols available from Schmitt-Thompson, including the differences between them, and then ClearTriage is a software platform that lets you use those protocols, including the free version on which you can use the COVID-19 protocols. I will open this up for questions at the end, but in the meantime, let me go ahead and jump in and show you what we have available. First slide is around what telephone triage protocols are we using? Where do they come from? So we licensed the Schmitt-Thompson telephone triage protocols. These protocols are from the primary authors of Dr. Barton Schmidt, who's a pediatrician, Dr. David Thompson, who's an internal medicine doctor. They both worked in the ED, they both worked in call centers, and they've been working on these protocols together for many years. They are the most common protocols used in North American medical call centers, taking primary care triage calls. At this point in time, they're used in over 25 million calls a year. They have book versions as well. The original version of the protocols was written by Dr. Barton Schmidt, the pediatrician, so the book versions are published by the AAP. His partner, David Thompson, wrote the adult telephone protocols book, and so those are published as a set by the AAP. The protocols are evidence-based, they're reviewed nationally, and they are updated annually based on changes in national guidelines, based on research that the authors and their teams do, and based on feedback from nurses. So triage nurses and nurse managers ask questions, and that feedback loop really has helped improve these protocols. I say the protocols are updated annually. That is the common path. The exception is when there is a major outbreak of something, and so a protocol is needed, such as that has happened recently for Ebola, and now is happening for obviously for COVID-19. So the COVID-19 protocols, they have two different COVID-19 protocols, and the best protocol to use depends on the location of the caller. So one protocol is the exposure protocol, the COVID-19 exposure protocol. And this is for locations that are identifying COVID-19 cases based on close contact of the patient with someone else who has been diagnosed with COVID-19, suspected to have COVID-19, or if the patient has traveled to a location with high community transmission to a foreign country where COVID-19 is widespread. These suspected cases are then referred for testing. The other protocol is the COVID-19 diagnosed or suspected protocol. So this is obviously for patients that have already been diagnosed, but it's also for locations that have a high community transmission rate, where the triage nurse is assuming anyone with a fever or cough probably has COVID-19. And so what happens is severe symptoms are treated, referred to the appropriate resource, but mild symptoms, mild fever, mild cough, the patient is told to stay at home, to quarantine at home, and testing isn't recommended. And they're told to call back if it gets more severe, if it starts moving into breathing trouble. Just from a statistical point, so looking at the data for the past week and a half, almost 2/3 of the calls in the US are using that diagnosed or suspected protocol as opposed to the exposure protocol, just giving you a sense of that. You could think the common places that might use that diagnosed or suspected, the easy ones to identify would be New York or Seattle, but it's obviously moving into far more of our cities. The COVID protocols were developed with feedback interaction with the CDC. They are updated periodically. We are currently on the third version of the exposure protocol. The diagnosed and suspected protocol came out more recently. But even with those regular updates, things are changing so quickly they can get out of date. So for example, the latest version of the protocols came out on April 1st. Very shortly after that, the CDC changed its position on wearing masks in public. So that is different than what's in the protocols. So you need to continue as a triage nurse to stay abreast of what's current. You can refer to the CDC website You need to use your nursing judgment, but these protocols will give you a structure to take the calls. So those are the protocols. What is ClearTriage? So ClearTriage is a software platform that uses the Schmitt-Thompson protocols. It's a decision support tool for telephone triage nurses to help with that decision of where someone needs to go and what time frame. And it's also a documentation tool. So what the nurse types, what they click on becomes part of a note that gets stored in the patient's chart. We hear different things as far as what people value, but those 5 sub-bullets are some of the most common: that consistency and safety of the triage, which if you are in the midst of a surge of calls from the pandemic is even more important, because it is human nature that if you are doing a knowledge-based task and repeating it over and over again, you will drop tasks in there. That's why pilots have checklists for say takeoff. That's why surgeons have checklists. And so that's why it's even more important to have a checklist if you're taking repeated COVID-19 calls. It can be easier and faster for the triage nurse with less to type, a nice standardized format of notes in the chart. It can also be easier to bring in new nurses. So if you are changing your staffing to handle additional calls, or if you're moving staffing around to handle your patient load, it can be easier to bring in new nurses who don't typically take triage calls. ClearTriage works with any EHR, any CRM system, any call management system. So wherever you're storing information about your calls, the note can go into that. I'll show you how that works. ClearTriage doesn't store any patient information, so you don't have to worry about another area with your PHI. The regular version of ClearTriage with the 450 protocols comes with a 30-day no obligation free trial. The COVID-19 version of ClearTriage is the exact same tool as that regular version of ClearTriage, except it only has the COVID-19 protocols, and it's free. It's not just a free trial, it is free while it is helpful. We're making it available for free, as are the authors of the Schmitt-Thompson protocols. We're making it available for free while it is valuable to help with the calls coming in during the pandemic. You create a singular account. There's no limit as to the number of nurses that can sign into that account at the same time. So you'll pick an ID and a password. Everyone will sign in with that ID and password, keeping in mind that we're not storing any patient information. That is the URL to sign up for the free version of ClearTriage. Also, if you just go to www.cleartriage.com, a banner will come up advertising the free version. You can click on that and you'll go to the page where you can sign up for that free version. One important choice as you sign up for the free version, you can choose to either use the daytime, the office hours version of the protocols, or the 24/7 version of the protocols. It really depends where you're taking these calls. If it's a daytime clinic, you're probably better off using the office hours, that daytime version. If you're taking calls all during the day, you can use the 24/7 version. So that's it for the slides. Let me go ahead and show you how ClearTriage works. So as I mentioned, when you sign up for a free trial, you'll pick an ID and a password. And by the way, signing up for a free trial takes just a couple minutes. The free trial, I'm sorry, not the free trial, the free COVID-19 account is active immediately when you're done. When you sign up, you'll pick an account ID and password. It does not have to be a super secret password because everyone will be using that. And again, we're not protecting any patient information. So you'll sign in with a first name. We don't care what that first name is. That name is used only. There's a report that shows how much each person uses ClearTriage, and so that's where that name factors in. But the ID and the password you pick are what signs you into your account. So the nurse, as they started their shift, would sign into the ClearTriage COVID-19 version. They would also have your EMR or your call center system, whatever system it is that you're using to track these calls. I have a number of different EMRs I can show you, but it will work with any EMR. At this point in time, our customers are using ClearTriage with over 80 different EMRs. So it could work with Epic, it could work with Cerner, with Greenway, with Allscripts, with eClinicalWorks, any of these different EMRs. I'll demonstrate with Epic and a couple others just to show you how that works. So if this is your patient, You would look them up so you could see recent medical history, allergies, you can get age, you can get if they are an at-risk individual. I would also have ClearTriage running, and I have here the adult and pediatric versions of these protocols. That's what the A and the P stands for. And you can see the two protocols I talked about, the exposure and the diagnosed or suspected protocol. I would start by typing my initial assessment up here. So this is the caller, the symptom, the severity, the duration, and so on. So Mark called, complaining of fever and cough. Temp has been about 102 for last 24 hours. Cough started 4 hours ago. So let's say, let's start and say that we're in an area that the exposure protocol is appropriate. So we're trying to track if this person has had contact with an individual, has traveled to a high-risk area, and if so, we'll likely refer them to testing. So Mark's in his 40s, I'll use that adult coronavirus exposure protocol, so I'll click on that. I have information about what this protocol is for, and that again is talking about the difference between those two protocols. So I will then press next, and this is the heart of the Schmitt-Thompson protocols. So this is a checklist for the nurse. You have a series of questions, and they're arranged in acuity order and they're grouped by disposition. So if anything up here is positive, the patient needs to call 911 right away. Moving through things that would send them to the ED right now, send them to the ED or potentially triaged by a provider, something that they would get a call from their provider within 24 hours, or things they can take care of at home. So the idea is the nurse goes through these and rules them out until they get to the first positive. Ruling them out, that idea is key. They're not asking each one of these. You're not turning the nurse into a mindless robot. So I've been talking to Mark. His voice has been fine. I know that he's not having severe difficulty breathing. But it is, as I get down here, I get to this question where it says fever or cough and within 14 days of COVID-19 exposure. So let's say a coworker did test positive for COVID-19 4 days ago, and Mark had worked closely with that coworker. So this is my positive question. They need to call the PCP, so the PCP needs to talk with them within 24 hours. Depending on my call center, I might transfer this over to a provider right now. I might tell them to call their PCP. If I'm providing a community hotline, say, okay, you need to call your provider within 24 hours. However, whatever they can do to talk to that provider within 24 hours. I will press next, and I have care advice that's pertinent to this. So I see here there's an alternate disposition where I can refer them to telemedicine. I can tell them that testing is probably appropriate. They'll talk to the provider to do that, to determine that, but really you do need to isolate at home. You need to cover your mouth or nose, and there is more information down beneath those different things as far as what to reinforce with the person. Make sure to wash your hands with soap and water, and then most importantly, make sure if any shortness of breath or trouble breathing occur, you give us a call back right away, or if you become worse in any way. So I do my assessment, I pick the appropriate protocol, I go through the triage questions until I get to the first positive, and then I give care advice appropriate to the situation. So I work at that plan of care, make sure the caller agrees with that. When I'm done, I press the copy button in the lower right. I go back to the patient's chart, in this case Epic, and I paste. I have the note that I typed up top. I have the protocol I used, the disposition, the positive triage question, all higher acuity questions were negative, and the care advice I discussed. And this is just text, so I can edit it if need be. At this point, I can save it. All of the functions of the EMR are part of this because it's just in the EMR. And then so if I want to route it to someone, whatever you do with your triage notes. And that's how it would work in Epic. So if I was using eClinicalWorks, it would go into a telephone encounter there. I would paste it there. If it was in Allscripts, I could paste it into a chart attachment. So you get the idea. That's why there's no IT setup necessary. You sign up for the free trial, it's ready to use right away because you're just using the web browser, pressing copy, and then paste it into the patient's chart. When you're done with the call, you would press reset. So let me show you how that same call would be handled with that diagnosed and suspected protocol. So again, this is something that if I'm in a high transmission area. So let's say I have that same note. So Mark has temp of 102 and cough. So I would press next here. Again, this is a situation with this protocol where I'm triaging and I'm trying to identify all of those high risk factors of fever or a cough, because otherwise I'm going to have him stay at home. So I'm ruling out the difficulty breathing, the difficulty awakening, the bluish lips, and so on, working my way down through no chest pain, no, the fever is not greater than 103, not greater than 101 at age over 60, and so on. So what I'm doing is I'm ruling out, and I didn't mention this before, but the little eyes here have information about what I'm ruling out. So these are I'm a triage nurse. I have to recognize that there may be other causes for some of these things other than just COVID, and Mark may need treatment because of that. But let's say in this case, I do rule out all these things. I do suspect it's COVID-19 infection because there's mild symptoms of fever and cough, and there's no trouble breathing, so he's going to be okay at home. You do always, once you pick that positive question, you do have the ability here to override that disposition. And so I could send him to a test location, I can send him to the ED, have him talk to a PCP, and I can capture why. So maybe it's my nurse judgment. Mark in his late 50s, worried this could turn bad soon, want Dr. Smith to review. So I can, as a nurse, quickly override the suggested disposition of the protocol because my judgment is key. It's my judgment combined with that checklist that's going to get optimal outcomes, especially if I'm processing a lot of calls. I'm going to skip that. Well, I'll do that override so you can see what it looks like in the note. I will leave it there. I do have care advice. So again, I can tell him that he probably has COVID-19, should be able to stay at home. You have the doctor talk to him just in case. I can talk about how to protect the others, about staying at home, covering the cough, washing your hands. And again, call us back if that fever gets higher, if it lasts more than 3 days, if it goes away and comes back, if you have chest pain or breathing difficulty. I didn't mention last time you can also send handouts. So we're using the CDC handouts here. So since we suspect Mark has COVID, I could send that sick with COVID-19 handout. And so that has information about what to do if you are sick in order to help stop the spread of COVID-19. And the CDC is updating those regularly, and we're adding those updated handouts. So with a handout in ClearTriage, I can email or I can text it to the caller. So for instance, if I want to email it to myself, and when you're emailing or texting, you will tell the caller that I'm sending this handout. It's not going to have a password. So if someone got a hold of your email or your phone, they'd be able to see the handout. Are you okay with me sending it to you? They'll say yes, you mark that consent, and then you can send the email or text. So that consent is the guidance from HHS around what needs to happen in order to send a care advice handout to a caller, either by email or text. It will say that it's from your organization. They can't respond to the handout, so they can't start a two-way conversation. In fact, if they do try and respond, they'll get an error, or it'll say, if this is an emergency, call 911, otherwise talk to your doctor. So again, you can't have that communication over the unsecure network. It's a great way to quickly get information to them, which helps reinforce what you've been discussing and can also shorten your call times, which is especially important if you're taking a high volume of calls. When I'm done with the call, I'll press copy. I come back here, I'll just switch, let's say that we're over in Cerner here, and I want to paste it there. So I have the note I typed, I have the protocol I used, the disposition was home care. I overrode that with call PCP now because of nurse judgment, and this is my judgment about why he needed to do that. I have a positive triage question, a note that all higher acuity questions were negative, and again, the care advice I discussed. And down at the bottom, note that the handout was sent to that email address. Again, when I'm done, I come back here and press reset. That's the basics of taking a call with ClearTriage. So it really is providing that quick checklist and providing a quick way to document the call. There are administrative features within ClearTriage, a couple important ones for you during this time. One is the account settings. So the account settings let you change the style of documentation. So it doesn't change how you are taking the call as a triage nurse, but you can choose if you're documenting just that first positive triage question, or do you want to also document the positive and the negative triage questions, in which case there are yes and no buttons in front of each of the questions. And the care advice, you can document, we were kind of in the middle of the road where we were documenting the care advice topics we were talking about, but you can also document the details of the care advice that were discussed. Those sub-bullets under there can be part of the note. Or some organizations just want to document that they discuss the appropriate topics and reasons to call back. So that's the way you can change your documentation options. Customization, you can customize the dispositions or the protocols. Note, by the way, that there are different dispositions for pediatric and adult, so make sure to make the changes to both if appropriate. But for instance, if the call PCP within 24 hours, let's say that you're in a situation where you really want to use your providers and you're setting up telemedicine visits. So I could telemed visit with PCP within 24 hours. So now in all four of the protocols, the pediatric and adult, exposure, and suspected, that protocol will now say, schedule a telemedicine visit within 24 hours rather than call PCP. And likewise, this one in that same case is, I would say, telemed visit with PCP when office is open. So that's how I change the dispositions. I can also customize the protocols, which would let me add my own add my own questions, add my own care advice, edit the questions or care advice that's there, or even just move questions between different dispositions. So if you have a different way of handling it, maybe you're starting to, maybe the country moves and you're having testing of COVID happening in the patient's home. So maybe you're setting that up as a result of one of these. So I can customize the dispositions or the protocols. There are also reports that show how much you're using each of these protocols, where you're referring people, how much each person is using ClearTriage. I guess I could click here on the overview, and how much you're taking advantage of the handouts. So those are the different reports within ClearTriage. I will go back to ClearTriage now and just want to show you the disposition that we changed. So if I click here on that protocol, I now have here we changed these to be telemed visit with PCP, are those two pieces. And one other piece I haven't mentioned is you can add sticky notes. So if I select a protocol, I can add a sticky note. That's that information up here that says account specific information. That's just a quick way to make note. So for instance, if you were in an organization spanning multiple locations, some of which are high transmission, some of which are low transmission, you can make a note here, hey, we're using this for these counties, and I can make a note here that I'm using it for these counties. So just a way to capture that information and quickly put it there. This is the online version of ClearTriage, which again is going to make it easier for your nurses to use it and easy for your nurses to document the calls. If all you wanted was the protocols, and you didn't want to use the software, I will say that on our website, if I go to the bottom here to the blog, there is an article about telephone triage and the coronavirus protocols. This article does have PDFs of the protocols. And so if you want to print those out and use them, you're welcome to do that. But again, the COVID-19 version of ClearTriage is a free version that you can sign up for and use. That is my talk today. I will open this up if anyone has any questions.